Namaste and welcome everybody. You are watching Future Ready Doctors.
A lot of clinicians want to learn everything just by seeing some videos on YouTube. I mean, it's a criminal offense. Let me tell you, I call it criminal offense.
Today's theme is extremely powerful. The future of dentistry, AI, automation, corporate style working, corporate systems, and the future beyond. How would you see what has COVID left us with? What are the learnings?
What I learned in COVID that you should learn how to survive with limited resources. We learned how to manage day-to-day life.
What is your one advice for the youngsters who are actually maybe in medical schools and dental schools?
They lose their concentration because of the social media, the peer factor, their friends. But if you sustain and you are disciplined, you will definitely reach your goal.
So one of my patients put up all the radiographs, the images and all the photographs on the ChatGPT, and she came up with a treatment plan printed in 15 sheets to me. Okay, doctor, this is the treatment plan.
The worst thing what I see about Google is that they imbibe the worst from the Google. A small lesion in the mouth, they will anticipate it as an oral cancer.
In comparison to the international scenario, are we lagging behind?
We are the same people treating in US, Europe, but in a different environment. So there is no problem in terms of clinical outcomes. The problem is
how to go about team building in the medical space, especially in dental clinics. Emotion floating in the air that corporate hospitals are just for money making. Can dental implants be totally robotic and AI driven? Will AI replace dentists? How you plan a corporate kind of a structure. Corporate hospitals are just for money making. How tough it is in the current day and age with the gamut of social media. What has kept your passion alive in general dentistry? What would be that one advice you would give to your 21-year-old? How do you see the emotional health of dentists or doctors in general? Let's begin. Namaste and welcome everybody. You are watching Future Ready Doctors, a channel dedicated to shaping the next generation of doctors who are not just skilled, but are AI ready, future ready, and ready to empower the healthcare ecosystem and help millions of people have good health. This episode is a part of our exclusive series, Doctors AI Leadership Podcast, where we decode what it really takes to lead in the age of artificial intelligence, automation, and exponential change in the healthcare field. Today's theme is extremely powerful. The future of dentistry, AI, automation, corporate style working, corporate systems, and the future beyond. We are going to go beyond a dental clinic to talk about leadership, innovation, and what is the next thing in dentistry and healthcare as a whole. Whether you are a student, a practicing doctor, or a health leader wishing to stay ahead in this era of AI, automation, corporate systems, this conversation is for you. Let's begin. Hi and welcome. This is not just a podcast. It's a space that we have created for you, me, and all of us who believe that there's something that needs to shift in the way healthcare is lived and practiced. We are not here to preach. We are not here to tell you that we have all the answers. We are here because we are curious, just like you. Curious about how doctors like you and me can stay human in a world that is so rapidly changing. AI is coming. It's already here. Systems are changing. Expectations are rising. And somewhere in the middle of it all, it's us, trying to be good at what we do, trying to care, trying to lead with our hearts intact. This is a podcast where we sit not as experts versus learners, not as influencers versus followers, but as fellow travelers, as doctors who want to ask deeper questions, as professionals who want to grow, not just in skills, but in soul, as people who want to remember, why did we choose this path in the first place? We will speak with each other. We will listen. We'll explore AI, leadership, future trends, system challenges, and most importantly, the real stories behind a white coat. Because the truth is that nobody is coming to save the system, but together we can transform the system. If you are here, you are already a part of this movement. You don't have to have all of it figured out. Just bring your story, your voice, and your questions. Welcome to Doctors AI Leadership Podcast, brought to you by Future Ready Doctors. Let's rethink what it means to be a doctor in this age of intelligence, uncertainty, and possibilities. Let's do this together. I'm your host, Dr. Anupam Agarwal, founder of Future Ready Doctors, a community where we explore the intersection of AI, artificial intelligence, and automation, of human intelligence, leadership, and healthcare, and how it can empower the lives, both the personal life and professional life of doctors, and the whole ecosystem of healthcare, so that we can lead to a prosperous nation wherein the healthcare is the central pillar of support and treat lots of patients and create millions of smiles. Hello, friends. Welcome to Future Ready Doctors YouTube channel, where we explore the intersection of AI, automation, leadership, human intelligence, and healthcare. And today we are shooting a very first episode on the Doctors AI Leadership Podcast. And let me tell you, the theme of today's episode is the future of dentistry, AI, automation, corporate style of working, and going beyond. And let me tell you one more important thing. I totally believe that the things that we are going to discuss today are going to be path-breaking and are going to give you lots of inputs with regards to how to proceed further in the field of dentistry per se and overall healthcare in general. And at this juncture, I would like to wholeheartedly welcome my guests, Dr. Ajay Sharma sir.
Hi, Anupam.
Hello, sir. And Dr. Seema Sharma ma'am,
Hello, Anupam.
who have graciously agreed upon blessing this very first episode of our podcast. I welcome you both, sir.
Thank you so
Thanks for
much.
coming.
It's a privilege, Anupam, to come for this first episode. And I wish you and the entire team that in future we'll have, such programs coming up. And we both feel privileged to be the part of this. And, it's a lot of responsibility as an opening batsman for this program. And thank you so much for inviting both of us.
Thank you, sir.
Thank you.
Thanks. And now I would like to formally introduce my guests. So, Dr. Ajay Sharma sir, first of all, both of these individuals have not only served thousands of patients with compassion and excellence, but they have been the leaders in the field of dentistry. And they have set up a culture of healthcare leadership in their own inspiring ways. So personally, I have been inspired a lot by the way you function, the way you carry on with your clinics, and more importantly, the kind of human beings you both are. Whenever I come to your clinic, I feel very welcomed, very well taken care of. And somehow that has impacted me a lot with regards to my own value system, that how should I be in front of my colleagues, my junior doctors, and my staff overall. And not to miss, the kind of care both these doctors take care of their patients is ultimate. So, firstly, we have with us Dr. Ajay Sharma sir. He is a highly respected prosthodontist whose precision, depth of knowledge, and futuristic approach to dentistry makes him a voice worth listening to. Dr. Ajay Sharma sir is a consultant prosthodontist, oral implantologist, and head Department of Dental Sciences, Max Group of Hospitals, New Delhi, India. He is a fellow and diplomat of International Congress of Oral Implantologists, USA. He's a diplomat of World Congress of Oral Implantologists, Japan. And I have a huge list of his accomplishments. So I would wish to just carry on with the podcast because it will take me ages to recite sir's accomplishments. Coming on to ma'am, we are being joined by Dr. Seema Sharma ma'am. She's a visionary general dentist known for her patient-first approach and intuitive understanding of care in both clinical and emotional dimensions. Together, they are not just partners in life, but also partners in a purpose, the purpose of giving ultimate experience to patients for dentistry. And they bring wisdom from both experience and evolution in the field. So in this powerful episode, you can expect candid insights, future predictions, and game-changing perspectives on how dentistry and healthcare at large is transforming right before your eyes. Whether you are a dentist looking to adapt, a student dreaming big, or a leader preparing for what's next, this conversation that we're going to have over here right now will leave you with clarity, courage, and a whole lot of inspiration. Let's begin. So, sir, we are in the first segment of our podcast, and this is diving in the soul. Diving in the soul. So let's begin where all journeys begin and start with the why. Not just the why, the technical why, the emotional why. That why did you choose dentistry? Why? How did this journey begin? What was the starting point? What were the emotions when you embarked on this journey, which eventually is fructifying into a thing that is helping all of us? So I would like to ask you the first question of this podcast, that is, what drew you to prosthodontics and was there a defining moment that shaped your direction?
Well, Anupam, I'll start first with dentistry, why I chose dentistry. In year 1988, I joined Maulana Azad. My rank was in top 100 and people with that rank aspired to join medicine. But I chose dentistry because I saw dentistry was that field which was ignored for a long time. And I saw that this is the field which is going to come up in next 25 years. Because I've been observing in the Western world, and especially in US and Europe, dentistry was doing extremely well. And today also it is one of the most demanded field. So I thought maybe this is the right time to get into dentistry. And I'm telling you, that was one of the best decisions of my life. And despite having one of the top 100 ranks, I joined Maulana Azad and I got into dentistry. Rather, that time, some of the professors and some of the students told me, why are you going into dentistry? But now they say, oh, Dr. Ajay, you made the right choice. So when I joined dentistry in 1988, and that time the dentistry was coming up, at a very meteoric phase and very, in a lot of newer innovations coming in, and dentistry was the need of the time. And see, today in year 2025, dentistry has come a long way, and it is one of the most, demanded, one of the most glorified field in medical science. And if you see in terms of artificial intelligence, we are the field in which we see the maximum innovation. And from last 10 years, especially in terms of imaging, we are seeing a lot of, artificial intelligence playing a major role. And very soon dentistry will be, fully taken over, I'm sure, in terms of artificial intelligence and whatnot in terms of medical science.
Thanks, Dr. Ajay, for sharing that. And it is throwing me into a goosebumpy mode that what would have been your mindset when you have gotten rank which is under 100 and you went against the social norms? So what would be your advice for the youngsters who might be watching our podcast, that when we have a preset notion in our mind, a social conditioning, how the life should be, what should be our choices, and most of these choices have been told to us by maybe, quote unquote, our parents, our society, well-intentioned parents, of course. So how can a person live authentically in this era of so much of distraction and so much of things who grab our value system?
Absolutely correct. Anupam, what I'm seeing is that there is a lot of peer pressure even today. So whenever you study for medicine, your aim is always to go for MBBS, MS. And a lot of people, don't think about dentistry. And dentistry, they take it as their second choice. Trust me, I don't agree with you. Whatever you do, whether you do dentistry or whether you do medicine, you do it wholeheartedly and there is no limit. And that's what happened in my case. And my first choice was dentistry because everybody was turning right and I turned left. And see where we are. And we are now today, we are running 4 companies, parallel companies. And we have the complete, the clinical solutions. We have complete lab solutions. We have complete diagnostic solutions and sale purchase of what you call as one of the companies we have is the Flight and Equipment LLP, which is our youngest baby. And very soon we'll have one of the manufacturing units. So there is no limit whatever you do. So Anupam, my message to all the people who are coming into this field, whether they are going to dentistry or medicine, do it wholeheartedly. Don't do it just with half passion, whether you do dentistry or whether you do medicine.
Thanks a lot, Dr. Ajay. And this makes me being aware of the famous quote I heard from somewhere that there's no right or wrong decision. You take the decision and then you make it right.
Absolutely.
So again, kudos to you and thanks for being a source of inspiration for lots of people, including me. Thanks a lot.
Here, I would like to add also that since Dr. Ajay was saying that it was his first choice, even for me, it was my first choice because I was seeing like my mother and people going for dental treatment. It used to be always like observing dentists working at that level. So I was always very passionate that, when I grow up, I would also like to join this profession. So it was always our first choice, that way, from our heart. And I was very artistic. So I would always, feel that dentistry is a field where my passion would be, really accomplished.
Thanks a lot, Dr. Seema. And here I would like to ask you that during this entire journey, because I feel that it's very easy to have passion and get on board, but what makes one have that passion alive throughout the journey? Because in the journey of graduation, maybe 4 to 5 years, and then afterwards as well, there might be times, some dark moments, some shady corners where the passion, the light of the passion doesn't enlighten at least our hearts. So, what is your one advice for the youngsters who are actually maybe in medical schools and dental schools, or who have just passed out? That in those dark moments, how can they keep that flame alive, that flame of passion?
See, every profession has its ups and downs. And I would suggest to the new generation, the coming up dentists and medical children who are in the field of learning, please sustain and be sincere and disciplined. You will reach your goal. Lot of our kids, these days, they get into, they lose their concentration because of so many factors, the social media, the peer factor, their friends. There are so many distractions. But if you sustain and you are disciplined, you will definitely reach your goal. Even like we, both of us being in the same profession, our son now, he also he is now doing dentistry just because it is not that. It was his first choice. He also cleared the NEET exam 2020 and he was getting MABS. So it is not that, you learn from your parents. If you love your profession, that is how you are a role model for your own children also. So that's very important, that if you have, compassion and sincerity towards your profession, child sees whatever you are doing for your entire life. So that's very important, that you are the role model for the coming up generations. That's very important, Anupam.
Thank you, Dr. Seema. And this makes me get into some self-reflection mode as well. I had been talking to Dr. D. Martini, and he's a motivational speaker, and he's a well-known researcher as well on human, psychology and everything. So I was talking to him that how I should let my children, do things authentically. So he said, when it's a nice thing, that you should not try anything. The word is exemplified parenting, which you just
Very
mentioned.
true.
Exemplified parenting. He said, if you are doing what you are telling them to do, then they will eventually have that energy around and they will be having a reference point. So I could totally see that in your son, might be in the genetic code or the epigenetic code for that matter, it's embedded to live authentically and not be guided, that getting the feedback from the people, but having your own inner voice alive by virtue of choosing dentistry and joining the bandwagon. So this might be a definite a milestone of understanding for the lots of people who are actually the youngsters who are on that fence of choosing where to jump on. And this is going to be a very nice maybe milestone in your journey. And when you look back 5 years, 10 years from now, you can replay this podcast that we are having and thank Dr. Ajay and Dr.
Very
Seema.
true.
Absolutely. Absolutely.
And I have one question for you. What has kept your passion alive in general dentistry over the years? Because there might be some challenges. Dentistry is also changing. And especially I would like to bring the context of COVID. Because during COVID, lots of things happened in the personal spaces, in the personal lives as well as in the professional space. So, and I've seen you having that passion, coming to the clinic, wearing masks, all the gear, and having some personal life challenges as well. So how did you, and especially what will be your message after that for the women in dentistry, that how to balance both the worlds?
See, it is that the women have to have two models, they are playing on an everyday basis. They are homemakers, and at the same time, they have to be professional also. And to the coming up generation and to the women who are coming up in this profession, my sincere advice would be, never give a second stand to your profession. You should always keep both them in the equal spaces. From 9 to 7, I work, I am a professional, but at the same time, yes, if I get a phone call from my house, from anybody, from my relatives, from my parents, anybody, I'm there to handle the situations. But yes, at the same time, I'm a hardcore core professional. I manage my clinic, my staff, my everything to the best of my abilities, and try to manage, my home after 7 or I try to, have this habit of inculcating, in my staff, the people who work around me, that yes, I'm available, but you have to manage those parts of the home. And once I'm in the clinic, please don't disturb me. So this is a very important aspect, that the helping staff should be trained that way. If you are a good professional, you have to maintain both the fronts and be successful in both the fields.
Okay. Thank you, Dr. Seema. And here I would like to bring the point, since we are in the segment of diving in the soul. And one of the ways of going into the soul is through the heart. So since you are a couple in dentistry, and I would call you a couplepreneur, right? So how do you manage the me time? The me time. And suppose Dr. Ajay is going to Max Hospitals for his work, then he's going abroad, you are going on your journeys. So how do you have that heart-to-heart connect and the soul connect? I would say, in spite of so much of happening in the professional life, how do you manage that? And this is a question for both of you, by the way.
I think I'll start with this, then Seema can take over. See, both of us are very, very professional. And let me tell you, from year 1998, we have been working together. And our chambers have been like back to back. And that's very interesting. And Seema never used to write Sharma. She always used to write Seema Nangya. And I always used to write Ajay Sharma. So none of our patients ever knew that we are husband and wife.
Wow.
So we used to work as two professionals in the adjoining rooms. And we used to see our patients, and we used to have our own, diagnosis, treatment plans. And it is not that always we used to have a consensus on the treatment plan or the diagnosis, and there was a different school of thoughts.
Yes,
and
we had our own fights also.
And sometimes we used to have arguments also regarding the case. Why you did this? She said, no, why you did this? So this is right. And sometimes we used to appreciate also that this was the right decision, and here we are. So when it comes to profession, definitely we are hardcore professional. We discuss as a team and for the better interest of our patient. And when we are at home, the same thing applies there. We take collective decision because we are husband and wife, and we argue. All husband wives argue.
But we are best of friends.
And we are best of the friends. I think Seema can further elaborate on
Well, in professional life, I always look upon him because he was my senior from college. He came to do his master's in KGMC. I'm a product of KGMC. And definitely, I always look upon him for his good advice. But at the same time, now, as we have evolved as professional, I also have my own opinions about how to go about it. So we definitely discuss our professional life. And at the same time, at our home front, definitely, I am the boss. So he tries
No, she's the boss at the clinic also, because I always report to her. She's the boss.
So that way, it's a cordial, environment. We have our nick corners, we have our issues, but we try to resolve them.
Thanks, Dr. Seema. If you have to tell me the name of a movie that comes to your mind when you look back at your journey over the years, over decades, you being together, what is one movie that comes to your mind, the name, or maybe some metaphor?
That's a tricky question. Movie.
Any movie or song, any metaphor, any phrase that comes to your mind when you visualize your journey over the years?
I can recall Agnipath movie for that. So life is Agnipath.
Yes.
And your struggle never ends.
Mm-hmm.
You should carry on. And as you said, there will never always be ups and ups. There will be ups and downs. So you can recall Agnipath movie of Amitabh Bachchan here, where he says, Agnipath, Agnipath, Agnipath. So keep learning, keep improvising. That is what, because we are professional people, and we both believe in, improvising every day. Whatever we are doing today, we do. If we want to do it something new in the same discipline or same profession, because if you're doing the same old thing again and again, that means you're missing on time. So we believe in improvisation. So I think Agnipath is the right movie to say that.
Thank you, Dr. Ajay. Dr. Seema.
And we keep upgrading ourselves, Anupam.
Mm-hmm.
Doing one thing, for forever. It's not that funda what we, normally follow in our day-to-day life. We try improvising ourselves, our clinic, adding new things, whatever is happening. So that keeps the light, the energy active, in both of us also. And over these years, yes, we have evolved as, better human beings, as better couple. We understand each other more today than what we, last 15 years back or 20 years back. So it's like, it's a journey. And definitely, you have to understand each other. It's not that one has to keep an ego and let the other person say whatever. So it has to be from both the sides. You have to understand each another aspect of human beings, and go ahead. Life is beautiful.
Life is beautiful.
Absolutely.
Beautiful. Life is beautiful. And over here, I would like to ask you regarding COVID, because since we are in the segment of soul, COVID somehow had some, it shook our heart and soul to a certain extent, be it our personal lives, be it our professional lives, and we had huge losses as well at both the fronts. How would you see, what has COVID left us with? What are the learnings? If we have 3 learnings as a dental professional, and these learnings can be both in the personal and the professional front, regarding our future readiness, because the name of the channel is also, by the way, Future Ready Doctors. So what are 3 pearls from your side, Dr. Ajay, that COVID has left us with? Because every cloud has a silver lining. So what is your take on that? What are the 3 pearls that we can embody?
See, COVID times was one of the, the most harrowing time, which not only for us, for the entire world. And there were some, good things about COVID and the bad things about COVID. We all lost, some nears and dears. I lost my younger brother during COVID. And, but definitely during COVID, we learned one thing, that you should not stop struggling. And what I learned in COVID, that you should learn how to survive with limited resources.
Wow.
And that duration of 1.5 and rather 2 years, I'll say, we learned how to manage day-to-day life. And we were running up, we never shut down our practices for day one, not even a single day. Because in June 2019, we started one of our new ventures, which was one of the premium ventures of Focus Dental. And it was almost just after 1 year, the COVID set in, and our practice was new. So we never shut down our clinic, though with all the limitations, with all the protocols, we were running the clinic. Our staff was coming with rotation, with all, as you said, with the gears. We were treating patients. And in fact, I had COVID, though Seema and my son never had COVID, but I had full-blown COVID, my father, my mother. So what learning through the COVID was, and rather post-COVID, we learned one thing, that you should be prepared always for the worst of the time.
Wow.
And you should learn how to live with the limited resources, and improvisation with time is very important. And your discipline should be, always smeared up with best of the innovations.
Thank you, Dr. Ajay. And what will be your, out of your whole experience through the COVID era? Because I know you had been managing a lot.
I feel that that was a very tough time for me, because my in-laws, I lost Ajay's younger brother, we lost. And I was the only person who was handling the family. Ajay was also down with COVID. And, it was a very tough time, because, managing the staff, managing everything. But that has made me, very, very tough as a human being. I have become a better human being in terms of, understanding human values, and, understanding that, yes, the people who are working for us also have their own needs. I have, improvised our hygiene standards. And I have also seen, people have started valuing these things, the sanitization in the clinic and all those things, especially the time management. Earlier, Indian patient used to, not value appointments. Now, from the time COVID has come, people have started becoming, very, very aware of the appointment timings. They have become very aware of the hygiene, the clinic, and, the operatories, the instruments have to be, properly treated, autoclaved. So these things, in India have improved.
Yes.
What I have observed from 2020, the awareness of the general people, as, coming to the clinic, doing things has really improved. And this, has been a one step ahead in our, doing patients. And dentistry needed this, earlier times, from if I see 10 years back or 15 years back, people never used to value these things. So after COVID, a lot of these things have improved. And definitely, people have started realizing that, these things like sterilization and, fumigation and, using these, autoclave things, instruments has really, given a 5-star to the practice. So this is very important.
See, Anupam, dentistry is something where you cannot work from home and you deliver to the patient. The entire IT industry, and I see whatnot, everybody started work from home. And even today, if you see, a lot of the offices have been shut down, and the people report from office, they work from office, and they're happy. And the institutions are happy, professionals are happy, but that cannot happen in dentistry. So you have to come to clinic because you have to deliver it to the patient. So those standards of hygiene, as Dr. Seema said, and autoclaving, the processes have been more stringent and definitely more organized, and people are more aware. That's the best part. The people are aware, and they come and observe that what your doctor is doing, what the assistants are doing, what protocols you're following, because they know that it carries is for them. It's for their health. So earlier, which was not there. So earlier we used to explain it to them. Today we don't have to explain it to them. They say it and they know it.
Great. And do you see this as a definite shift in the patient's mindset?
Yes, absolutely.
Cellular belief level.
Yes.
That they actually have that folder, so to speak, in their mind of sterilization and cleanliness. And they actually have a secret expectation from our clinics and doctors that they will be providing that, which was not perhaps the case earlier at most of the places.
Correct. Today, when they enter a clinic and they see right from the entrance, the patient has become very sharp. And they know that where they're entering and what type of environment they're doing. And they will. Earlier, people used to ask no questions, but today, despite best of the infrastructure, best of the sterilization, they do ask us, and we feel very happy to answer them. At least that they are aware and they are concerned about their well-being. And we feel proud about our patient when they ask about what protocols you're following. And we generally take them for a tour of the facility to such patients who ask us, Dr. Sharma, what are you doing for sterilization? What are you doing? What is new in your clinic? How you're different from others? And how Focus Dental is different from others? So we take them for the tour of the clinic and we feel proud about it. Like, this is what our benchmark today is. This is what the dentistry is, and this is a new generation of dentistry is doing, and this is what is going to happen in future. So we tell them about everything, the present, and what is going to come in future as well.
Thank you. And here I would like to bring one more point that sometimes when we have discussion between us as professionals, we talk about the price war in dentistry, that many a times we see centers who are reducing the prices like anything without giving due credence to the quality of the treatment. So maybe it can be a good model not to have a price war, but to have a quality war, increasing the quality.
Definitely. And patients are ready to pay a little extra for the services you're providing. That's what I feel. Because they see everything. Now, when they come to the clinic, they see how from entering to how they are, welcomed in the clinic, how, the girls on the reception are behaving. So it's an overall package, so people are happy to, pay an extra amount, but get good services.
Great. And this makes me being aware of one more thing, just like hospitality industry, everything is experientially perceived by the patient.
Absolutely.
So I had one patient, if I can share with you guys, I had one patient who said, she came into the clinic, she walked around, she had her treatment, diagnostics done, and by the time she came to my chair, she said, let me tell you, Dr. Anupam, I'm very happy with the conduct of your staff. Everybody is smiling, I'm feeling so much at home. And she mentioned this, 80% of my pain is gone.
Absolutely.
So maybe it's the time to humanize dentistry, humanize the way we approach our patients, and it should go from top to bottom, from the hierarchy, the board of directors to doctors to junior doctors, up till the receptionist and even the watchman and everybody. So this can be the next journey towards how we can improve, and this can be a healthy war. Okay, fine, I am giving so much of value to my patients, what are you doing? Rather than going into that price war thing. So what would be your final words with regards to, if we have two things, one thing is price war kind of a model, which some of the doctors jump into versus the quality war, the value addition war? What will be your final take?
My suggestion would be that don't be cheap, don't be too expensive, be cost effective. And the quality comes at a cost. And don't, because the profession we are in, you cannot compromise on the patient well-being because this is related to health. And today, as we discussed, the patient is aware that quality will come at a price. So, as Dr. Seema also said, that your environment, your infrastructure makes a difference, and patient is very smart today. So, rather in continuity with this, we recently introduced our pricing on the platform of Indian Dental Association. Rather, we were the first one in Northern India, ID in Northwest Delhi, I being the president-elect. We introduced a common pricing, a minimum pricing for the dentists practicing in Delhi NCR, and rather I can share the copy with you as well. And we feel proud that we have been circulating that pricing, and that pricing is very decent, and especially it's a message to the people or to the dentists, the newer generation. Please stick to that pricing, because if you stick to that pricing, the quality will automatically come. And there is no competition in the market. Trust me, there is no competition. There is enough number of patients. Today also, the patient-dentist ratio is much lower what we anticipate. So we need more and more professionals. So you are the people who are demanded. So there is no price war. So there is no competition. Trust me, there is no competition.
Great. There is no competition, right? At this juncture, Dr. Ajay and Dr. Seema, I would like to ask you, we are talking about patient is aware and we should be having good sterilization in our clinics, clean spaces, good experiential things, everything. But if we see, everything has two sides to it. Don't you feel that these days the patients are having unrealistic expectations to a certain extent, because this topic is often discussed in the professional circles? The Google searches recently, AI, the ChatGPT. So one of my patient put up all the radiographs, the images, and all the photographs on the ChatGPT, and she came up with a treatment plan printed in 15 sheets to me. Okay, doctor, this is the treatment plan. So I was thinking at the back of my mind that then what's the need of a doctor if the patient is already so much quote unquote rightly, unrightly, fortunately, unfortunately aware? So what is your take first?
My take, Anupam, it's a beautiful question, and me and Seema always discuss this. You should, catch your patient moment he enters the clinic. Any patient who is coming to the clinic with unrealistic expectation will give you the signs at the reception only. And his unrealistic expectations, will carry on till the time you finish the treatment. And let me tell you, you can't make a 4 feet 10 inch guy Brad Pitt or somebody, average looking female Angelina Jolie. So, there are people coming up with unrealistic expectations. So we have to draw the line and we have to tell them that this is the expectations. This is what we will deliver to you. If you have something unrealistic, please, we are the wrong people you are with. You are at the wrong center. You should look for something, more enterprising or more advanced center, because we deliver what we commit.
And you have to put your foot down sometimes, you have to be on a platform and tell the patient that this is it. You can do correction till this level. What you're asking is like, it cannot be done. Something like, it's like you have to make the patient understand that this is the committed, what to the extent we can give you. This is human, and we are working on you. So it is not important that some picture or anything you are showing or reading on Google and coming back to us. So it is important to understand the what you're delivering, the final, is according to your requirement, according to your body requirement. It is not that what you're reading has to be Google or any app you're watching. It cannot be the same in every human being. Every human being is different. Every body is different. So the final result will definitely be different, person to person.
Got it. So what the idea I got from both of you is that perhaps we should be clear in our mind that what kind of patients we want to treat, and it's more important rather to decide who not to treat rather than whom to treat.
That's what I always tell Seema, as patient has a right to choose the doctor,
yes.
We have a right to choose the patient as well. And in all our waiting areas, Anupam, we put rights and responsibilities of the patient.
Wow.
Why not for the dentist?
And and this is what we have always displayed in our waiting areas. These are your rights and these are your responsibilities. So we honor both. So it's very
In
important.
fact, few of my patients, who have over this thing and, who are like, they become a nuisance after some time, who really don't want to understand that this is the level of treatment. So I have, marked them that if they have the right to choose the dentist, even I have the right to choose my patients. If you are not understanding what the maximum we can deliver, then I cannot take you. I cannot, do your work. So it has to be from both the sides. Even we have the right to choose our patients.
At this juncture, I'm having an awareness that, and both of you can answer on this, do we need to have a psychological profiling of the patients, something like that introduced in our clinics, maybe in the curriculum, so that we are also aware of what psychotypes of patients we, because if somebody is having an obsessive compulsive disorder,
Yes, absolutely.
so that what my mind tells me, chances are that person would be judging each and everything the moment that person opens the glass doors of the clinic, right from the reception, how everybody talked to me, overthinking and over-analyzing every aspect, which we fail to analyze. And if these things can be analyzed, then this can be a boon. So again, psychological profiling, how much it is.
Anupam, it's a beautiful question. It is, and this comes with experience. Only 1% of your patient out of those 100, these 1% of the patient ruin your practice, ruin your life, ruin your mental balance. Please get rid of them moment they enter your clinic. So this starts at the reception. Your receptionist, your counselors who are sitting there should be trained and groomed that catch these patients and get rid of them as early as possible, because they will make your life a nuisance. So because we are professional, we can treat them physically, but we cannot treat them mentally. So if they come with a closed mindset, and they are not ready to listen, like patient comes to us, and Seema is well aware, patient comes to us and the first thing we tell them, please give your general information, please give us your consent. Yes. They will refuse for the consent, they will refuse for the information. This is the patient you should not entertain. Let me tell you my experience. This is the patient. We always say, you should not entertain. Please put your foot down. If you're not ready to fill the consent, if you're not ready to give your general information, please, this is not the right place for you. What do you say, Seema, about this?
That's very true. Dr. Ajay always tells me that please follow this, because they will be troublemakers.
True.
Whatever you do, you do the best of the treatment. They will never be satisfied. So it is important to choose your patient the right way. And that comes with experience.
And on a hilarious note, might be our medical books need to be updated from having case selection criteria to also having a case non-selection criteria as well. And with due regards to everybody, because we have, being doctors, we have been trained in empathy. So we understand that everybody has a right to treatment, but at times we cannot devote too much of time trying to sort the mental condition of few patients and disregard the time of other patients. So from that point of view, definitely we should be having our own thought process regarding whom to treat and whom not to treat, and better send to some other centers where they can be taken care of in a better way.
But I think we were already taught that there are 4 types of patients: philosophic, indifferent, critical, and skeptical.
Yeah.
So you should know which category of patient he or she
fall
is
into.
and which category they're falling in, and then you have to treat them accordingly. So that philosophic, indifferent, critical, and skeptical patient is very important. Please, fellow colleagues, if you're studying, read them about these 4 categories, and they will, if you can categorize these 4 types of patients, your life will be made. Trust me, your practice will be roaring. So this is my message to all of you.
Yes, that's
Take home
very
message.
important. It's very important.
Guys, I'm really enjoying the conversation with the doctors right now. I hope you're also enjoying. Please make lots of notes, because what you write is what you invite. So please do that. At this juncture, I would like to ask you the final question of this segment. That is, if you could go back to your 21-year-old self, maybe you can close your eyes, you can be aware of how you were at 21 years of age. What would be that one advice you would give to your 21-year-old? And this can be in 2 sections. One thing that you would wish to do differently, and one advice that you would give to them in a different way.
My advice would be that everybody loves money, even I love money, but not at the cost of profession. Today, what I see, the newer generation is very impulsive. They want to get into practice and they want to make quick money. And there are many things there, maybe the peer pressure. but learning is very important, the profession we are in. And me and Seema, we go out all the way today. We go for learning, and there is no end to continuous learning. And we spent almost, I think, 15 years and before we got into the corporate practice or the self-practice. So those 15 years, learning made us so solid that today we can treat any type of patients. And that learning curve is very important, which you should not miss. Jump into practice, but have a learning curve of at least 4-5 years. This is what my message is, which is missing. Because even in colleges, that connect between the student and teacher is missing. In my times, if Seema agrees, in my times and her times, our professors used to be directly involved with us, and we used to have those seminars, regular seminars on day-to-day basis, and each and everyone from the faculty used to be the part of that seminar, which is missing today. That connect is missing today between the student and the teacher. Plus, the student don't want to learn, and student want to be, they want to, jump into profession too quickly. Please don't do that. Spend some time in learning. Spend 3-4 years, 5 years in learning, and then get into your clinical practice or your self-practice, and that will make you a different person altogether. Trust me, your practice will boom like anything. I think Seema would like to elaborate on this.
Dentistry is an art. And watching YouTube or reading a book will not make you a good clinician. So it's a complete journey. You really have to work hard with your hands, make things, do models, do everything on your own. Slowly, once you do come into that journey of doing things every day, you shape yourself as a good clinician, as a good dentist. So my request to everybody who is listening to us would be, don't go with small profits that, okay, I finished my dentistry, I'm going to just, join a clinic, open a clinic. My dad has so much of money, let's open a clinic. My dear, it is not going to work. You have to work with your own hands. You have to make decisions. You have to see patients every day. You have to give a good treatment plan. Most of the kids these days coming out, they don't even know how to make a good diagnosis. The correct diagnosis is missing sometimes. That's what we have seen, children joining after their MDS also sometimes don't know how to do a radiograph, how to read a radiograph. So those kinds of, things come with time, come with practice. So it is not one day job that, okay, today I have learned this, tomorrow I can do it. No, it's a complete learning curve. It takes years to shape into, become a good clinician.
Very true, Dr. Seema.
And one more thing, Anupam, which is missing in today's generation. I'm sorry, this is very important, that empathy. That empathy is missing towards your patient. Be considerate. Have that feeling your patient is suffering. Get into their mind. Be considerate enough. Go out of the way and help them. Give them a call. Maybe 2 hours after the surgery, or maybe next day. How are you feeling, sir, today? Are you having any pain? That empathy is missing in today's generation. You develop that attitude of being empathetical towards your patient and see the difference in your practice.
Very true. And at this point, Dr. Seema mentioned about YouTube. So right now, Dr. Ajay and Dr. Seema, the hue and cry is about artificial intelligence, AI. Will dentistry be relevant? Will dentists be relevant? And AI is eating jobs. I feel that rather than AI, the bigger question is the social media, the YouTube, the Instagram, and the current way and the manner in which our younger generation is using the Instagram. And everybody knows about it, right? It's a quick money-making thing. People are respecting followers more than fellow colleagues. So how do you see that in the current day and age, in the perspective of dental students, medical students? Is it like how tough it is for a person to be fully focused on graduation, post-graduation, and super specialization, then treating patients? How tough it is in the current day and age with the gamut of social media?
Social media is a need of time. I don't deny it, whether it's LinkedIn, Twitter, Instagram, Facebook. You cannot survive without it. But let me tell you, at the same time, it is very important. Please don't learn everything from social media. The profession we are in, a lot of clinicians want to learn everything just by seeing some videos on YouTube. I mean, it's a criminal offense. Let me tell you, I call it criminal offense. Please, we are clinicians. You need to learn the process. You need to learn the procedure which you're going to do. These are live patients. These are not engines. You're not repairing the engines of the car. You're working on living patients. So social media definitely is a big influencer today for the younger generation. Please do follow, but not blindly. Learn to choose what you have to imbibe from social media, not everything. And everything cannot be learned from social media. You have to come out of social media, do practical courses, do one-on-one interaction with the senior fellow colleagues. What they can teach you, nobody can teach you.
Maybe it's the time to come out of the real world into
Yes,
the real world.
to the real
Very
world.
true, very
Absolutely.
true.
That real world. And what I see, a lot of patients, they see on the Instagram a doctor talking about the procedure who has never done that procedure.
Wow.
That's the most amazing thing. And we see those doctors, talking about those procedures, and we feel proud. I mean, what is this happening on this social media? And patients blindly go there, get the procedure done, and then they come back to us that, like, we went to XYZ social media platform, got influenced by this so and so person. And so always, do a second thought, do your homework before jumping onto choosing your professional doctor or a dentist just by looking at the social media. Social media is doing beautiful job, no doubt about it, but don't imbibe everything from social media. I'm sorry, but this is the fact of life. And Google, above all, as you said, my all patients do Google and they come to me, and when they tell me, Dr. Sharma, I read on Google, I said, okay, you have come to the wrong person. I'm not the Google doctor. Please take your refund and go back. Look for somebody who can, talk to Google answers, and what you have in your mind, I cannot answer your Google questions.
Great.
See, everything is not goody-goody, na?
Yeah.
It has to be based upon what you're seeing in the patient's mouth. What every patient is different, as I earlier said. So according to their requirement, the treatment plan has to be, specific. So it cannot be what Google has written. Google has written just for, it's for the masses. So every procedure cannot be just the streamlined way it is. It has its own nick corners which have to be, done and cleared by a clinician only. So this is very important.
The worst thing what I see about Google is, Anupam, that they imbibe the worst from the Google.
Wow.
The anxiety and phobia for certain procedures
They
is so
go
high.
in depression. They
Yes.
come in depressive phase to us. I mean, a small lesion in the mouth, they will anticipate it as an oral cancer.
Yes.
Wow.
Just because they read and they imbibe the worst. They see the worst of it, and they come to us in a phase of depression. We have to counsel the parents, we have to counsel the child, we have to counsel everybody that this is not the problem, and this is not become, earlier it used to be once in a month or once in 6 months. And today, every day, we see these type of patients who have done Google on the particular symptoms, and they've gone in depression or they have a lot of anxiety, and we have to counsel them, no, this is not the thing. So
I think 2-3 days back, we got this boy who had a subcrestal fracture in the lateral. We told him to get it removed, extraction to be advised, and followed by an implant. He was not interested in that. He was interested that, oh, my cheek and my tissue is having a white scar, and lining is, not okay. So basically, he was reading about those aspects and, getting confused in the level of the treatment. So he was, no, I Googled it. It was like, the white line and this thing, the lip, which, when I fell down. So all those aspects he is looking into. He is not looking into the broken tooth.
which was the sole cause of the problem. So
The
he ignored the
sensitivity
sole
is
cause,
coming.
and he was looking at the signs and symptoms and correlating it to the worst of the clinical problems. So imagine where we are going. So people go on Google, people go on different platforms like ChatGPT, they ask questions, they get answer of the questions, and they imbibe the worst of it.
So don't you think that this is fueling the hypochondriasis? Like
Yes,
everybody's
yes,
feeling
yes,
that something
yes.
bad is going to
Absolutely.
happen. I can recall one of my patient called me and said she's Googled something, and the exact word she used was, "Doctor Sahab, मेरी बेटी खौफ में है." So I found it to be a very emotionally charged word, "खौफ," that fear of death, scared to death. And now, don't you think that maybe our constitutional bodies like Dental Council of India, Medical Council of India, I believe they might already be having this, but is there the need to outreach the patients at large with some educational material with regards to some moderation with regards to usage of Google and ChatGPT while having a thought process regarding treatment?
Absolutely. Now we will have the National Dental Commission into the action, and National Medical Commission. So, and I'm sure this with social media, dominating the world entirely, not only India, it's like pan world, and the newer generation, younger generation, even our generation is now getting influenced. And rather, this what we are doing podcast is going to be one of the part of the social media only finally.
Yes.
So in masses we are influencing lot many people. So my take on this will be, definitely it is the need of the time that the National Dental Commission and National Medical Commission should have some sort of a the guidelines or the norms issued for the better interest of the society and for the professionals.
Great. And if we see this problem to be multi-pronged, one person or one class of people who are being affected by this social media thing is the masses, the patients. So that can be dealt with the outreach program. One is the doctor who is treating or about to treat these patients. So what would be your advice, Dr. Ajay, for those doctors who might not be well equipped with the resources, at least psychological resources, to deal with these patients? And Dr. Seema, what will be your advice to the students, the medical students, the dental students who are in a fix, who are on the fence? They are trying to concentrate on their studies, but some of their friend is becoming an influencer and he's flashing his cars and his Dubai holidays and business class travels. So how, because since your son has already joined, how did you parent him to be focused, laser focused? So that's the question for you. First, Dr. Ajay.
See, my take on this will be, if you are good in your professional, learnings and your continued education program, definitely no social media, or nobody is going to bother you, and come what may, and your principles will not change whether your patient comes after seeing something on the Google or something on the Instagram. You don't have to be an Instagram doctor, you don't have to be an Instagram dentist. Everybody I see is making reels on Instagram, whether it's a ENT surgeon, whether it's a bariatric surgeon, whether it's a dental surgeon, and today is marketing on it. See, marketing is altogether a different thing. There is no harm in it. Marketing is the life of every profession today, so there is no harm in it. But when it comes to imbibing wrong things from social media, it becomes an issue. And same thing is with health professionals. So please, fellow colleagues, there is no substitute for learning. There is nothing which can beat your seniors and colleagues. So learn the right things clinically from your colleagues. Those training programs, continued education programs are the backbone, were the backbone, are the backbone, and will be the backbone of our profession. So please don't try to be a YouTube doctor. Don't try to be a Google doctor. So my advice is, stick to your clinical protocols.
Ma'am.
See, as far as my son was concerned, I was, always into, like, you have to be good in studies, good in sports. All these distractions will be there today. Even in the past, they were there, and in the future. But you need to study and you need to choose a profession where you are happy to, because that will be you will carry it your entire life. So from 10th, 11th and 12th, children should be, parents should be their best friends, because there are a lot of distractions. But at the same time, the learning, there is no substitute to, good learning. So the environment at home should be cordial. Parents should spend quality time with their kids. Definitely there will be some, tidbits here and there. The child would revolt. He will say that, my friends and these kids are going here, they are on social media. So all those things, why are we parents? We have to guide our children, That is why God made parents. So that's a learning curve. So slowly you have to discipline the child. You have to make them understand that, there is no substitute to good education. So that's supreme. And after, the kid gets into that professional life, you have to just monitor that the company he is in should be, good and balanced as a friend, because their mindset also, they are now adults, so they have their own mind. So automatically you cannot force things on them, but you need to have a friendly and cordial environment with them so that they become good friends and they discuss at home. So most of the parents don't have good relationships with their own children. Sometimes I have observed so much in our in our clinical life also. Parents come and their kids are not listening to them. They want some kind of treatment. The child says, no, not today. Why have you got me here? So those that rebel nature happens over a period of time. So it's for the parents to groom the child slowly. School, I feel they just go for some time. It is the home environment which shapes the personality of the child.
Absolutely.
That's very important.
Great. And at this juncture, I would like to ask you, since we have talked about social media affecting the psyche of the patients, hypochondriasis, unrealistic expectations, one important topic that we should discuss is the legalities of the matter, because the legal implications are increasing day by day because of some of these factors. So how would you actually approach the legal issues that are happening with respect to consumer forum or patients raising their voice against the dentist or the doctors in general? So how to approach, as a doctor, what will be your advice for me, for the people who are watching this podcast, that how we should approach the legal issues?
See, legal issues, why? First, let's understand why the legal issues have become more common now. It's coming because of more awareness. The crowd is more aware. There is more access to the knowledge from the social media again. So everything is available on the social platform. You want to know anything, you can know. So patient has become very smart. The consumer has become very smart. So what is happening whenever a doctor does a procedure? So the patient or the consumer is aware that whether he's getting the right treatment or the wrong treatment. But it is not always that doctor is doing the wrong treatment or insufficient treatment or inefficient treatment. Most of the cases, rather, it comes with the difference between the patient and the doctor's mindset. That lack of empathy, which I was talking. If you have that empathy towards the patient, most of the problems come because lack of that empathy. That connect between the patient and the doctor is a reason for most of the legal issues. And this is what my personal experience is. You should know how to handle your patient's problem, which may be related to only his clinical problem or his maybe psychosis also. So as I said, those 1% of your patient will be your troublemakers. First, you get rid of those 1% patient, most of your legal issues will be over. Because most of the patient come with mindset, they have come through reference or through the word of mouth, and they come to you. Today, it's very social media may be doing a lot of work. But trust me, even today, the maximum number of patients which we see in our clinical practice is the word of mouth. So when they come through reference, the chances of legal issues are very less. Because those references are your, brand builders, your brand ambassadors. So the patient comes with a, that factor that, yes, we are going to the right place. But definitely, you cannot stop legal issues. So how we can prevent these? That's the question. Is like from the very beginning, you should have the proper consent forms. You should have the proper documentation. Everything should be evidence-based, communicated to the patient. You should provide the best of the specialist-based treatment to the patient. And everything should be communicated. That's very important. That lack of communication is most of the times is a cause of legal issues. Don't give unrealistic, projections or the treatment plan. I believe anything discussed with the patient before treatment is a part of the treatment plan, and rest everything is an excuse. So when you make unrealistic treatment plan and you give unrealistic treatment plan to the patient, your problem starts. And definitely, as we discussed the 4 types of patient, philosophic, indifferent, critical, and skeptical, these type of patient will always be there. If you know what category of patient you should be there, that connect of that type of patient should be different.
Wow.
So legal issues will stay, will increase further. Let me tell you, I repeat again, will increase more. So keep at least 1% and 2% of your annual collection as legal. So for the legal issues, documentation is very important. Connect is important, and treatment plan should be explained thoroughly to the patient. Don't over project things. We don't overcommit things, and this is the cause of legal issues. And today, patient is very smart, very well informed. Will take second opinion, will take third opinion. So be prepared. So don't do anything, and if anything goes wrong, we are medical people. We are not giving any warranty or guarantee here. So it's a medical science or a dental science. So things cannot be 100% correct always. We can deliver, but we cannot guarantee 100%. So when we guarantee 100%, legal issues come. So don't guarantee that 100% to your patient. Tell them we will try our best and be empathetical to your patient. Most of the legal issues will be taken care of.
Very true. Absolutely. Your documentation, consent form, and your basic, conversation with the patient. Your behavior at the time before the patient comes, how you're talking to the patient, how you carry on the treatment, and how you finish the treatment, and the entire journey which the patient has taken with you. That mainly, makes things happen.
And at this juncture, when we are talking about the whole journey, like there might be legal implications despite our best of the best efforts to provide value and care to the patient. And apart from, we also have our own lives. So sometimes stress creeps in. There was a study which said that dentists are having lots of stress these days because they have close working environments, dental chair, and lack of travel. So what can be a mental resilience ritual, and how to take care of our mind, our mindset, and our emotions? Because ultimately we are social beings, we are emotional people, we are human beings. So how do you see the emotional health of dentists or doctors in general? What can be some rituals, and what can be some deal breakers, like these things should not be done at all? So what is your personal mindset ritual or emotional resilience ritual? How do you come out from your own dips at times? Because I can totally expect you to be human, so you might be having your own dips. So what is the whole thing about that?
See, Anupam, first of all, let me, take this question further as like, we are professional people, and the profession we are in, medical profession or dental profession, you can never get rid of stress. You have to live with stress because the profession we are in, the patient comes with the realistic or unrealistic expectation. We have to deliver it to them. So as I said, those 1% patient, be careful with them. And 4 classes of patient, as I already said, stress when you live in metros and when you have, big practices and all type of patient coming to your clinic and you're working 10 to 7 or 9 to 7, definitely stress has become your parallel partner. You cannot get rid of it. So keep a healthy environment. Take quick breaks in between and try to de-stress. Me and Seema de-stress by, being more social in the evenings, especially weekends. And we interact very, frequently with our patients. And that is one of the de-stressors for us.
Wow.
Whenever we are free, we sit and interact with our patient, have some healthy time with them in my chamber or her chamber. And that's one of the biggest de-stressors. And sometimes you try to connect with them, on a family basis, and you know how them personally, what do you do, what are your son, what is your daughter doing, what do you do in your free time. So that is the biggest de-stressor for us. And generally we work 10 to 7 and with a break of around 1.5 hours. That is another de-stressing factor. We meet our family in the afternoon and we have lunch together, and that's another de-stressing factor. So, but in profession we are in, you can never get rid of stress.
And I would suggest that everybody should exercise. Lot of new generation, people coming. The dentists, they don't want to exercise. They have a very sedentary, just get up in the morning, get ready and go to the clinic. Morning routine, get up early in the morning, have some exercise routine. That gives you, meditation, gives you some, breathing space, I would say. And you should have a hobby, listen to music. He wants to learn guitar these days.
This is my
so
new pitch.
it's his new hobby. So in fact, my son is passionate about learning drums. So we are planning very soon, for all these things. So these are like stress breakers, So it's very important. We have a small Shih Tzu and I take him for a walk, So those things, make you connected, with beautiful life and people, around you. So this is very important. We, as professional, we have, a lot of stress in the clinic hours, but you have to learn to live your life, with all those things, because it is not for one day. It is like what we have chosen is going to be in our profession, in the coming years as well. So you have to, it's a everyday routine. You have to make that way and be a disciplined, in eating habits. A lot of us, we have very erratic eating habits. So learn to have a balanced diet, eat less of carbohydrate, more of fiber-rich fruits, vegetables. We have inculcated this habit for, I think, we have been, from last 25 years. So that has taken us, in the long run. And we are that active in our clinical field as well as, our family life. We call over our friends, almost every month. We have a get together with our friends and our relatives. So that keeps, the energy alive in us.
That social connect is very important, to de-stress in this metro especially, Anupam. And let me tell you, me and Seema believe that it's very important that since we are in a profession where we interact with hundreds and thousands of people, it's our responsibility to give it back to the society. Because if we don't give it back to the society, who else will? Because if everybody starts thinking me first, then society is finished. So we believe anybody inviting us, irrespective of whatever the distance is in Delhi,
we always go.
We always go. Whether it's 20 kilometers, 30 kilometers, 40 kilometers, we plan it that way. We plan our evening that way. So it's like not only de-stresses us, it's our commitment towards the society which is fulfilled. So you have to give it back to the society. And this is what, keeps our tempo alive. And next day morning we are awake. We get up early 6 o'clock. As Seema said, the early morning walk, very important. Exercise is important. We have a very strict military schedule. Though I don't come from services. Seema comes from the service background. I don't come from a service. I come from a business background. But trust me, we get up at 6 o'clock. That's a routine. Healthy exercise,
so discipline
is very, very important if you want to grow and sustain.
Great. And guys, I'm really enjoying the discussion. I hope you're making lots of notes because what we are discussing right now is not just dentistry, but how to approach dentistry as a leader, approaching all aspects. And the idea I'm getting is, Dr. Ajay and Dr. Seema, that stress will be there. Stress will be there. It's a part of our life and it's a healthy stress. Being human beings, we are adaptive to it. But how we can maneuver our lifestyle, especially the social connect, giving it back to the community, having a legacy, so that can bring the leader from inside of us, and that can be much more better way of addressing the stress,
Absolutely.
whatever there is. Because these days a large industry is around demonizing the stress. The stress should not be there. You take pills, you pop in pills, you have all the things that may be the second line of approach, but not actually dealing with the social connect and the empathy that we have.
That pill of social connect is the best pill. Trust me.
Wow, the pill of social connect
is the best pill.
It's the best pill. Great, awesome. So we have come to the end of the segment 1. Thanks a lot for being so authentic, so real, and just adding so much of value to our podcast. Thanks
Thank you
once
so
again.
much.
Thank you.